Welcome everyone, and thank you for joining today's presentation on job description for the nursing leadership role we are discussing. Our goal today is to provide a comprehensive overview of the position, detailing the key responsibilities, required qualifications, and the skills essential for this role. A well-defined job description not only attracts suitable candidates, but also ensures that they understand their potential role within the organization. By the end of this presentation, we will have a clear understanding of the roles, expectation, and how to assess candidates effectively. It's a group portfolio presentation. We have Jigarbai Prajapati, Yashvi Chaudhary, Roshni Chaudhary, and myself, Inbadas Kanagatanam, in Human Resources Management, Nursing Leadership and Management. The overview about this presentation, we have introduction, importance of job description in human resources management. Why is it an issue in human resources management? Creating job description of nursing leader role and interview questions and summary. Introduction. A job description is a crucial document in human resources management that outlines the duties, responsibilities, qualifications, and expectations for a specific role within an organization. It serves as a foundation for various human resource functions, include recruitment, performance evaluation, and training. Job descriptions contain job identification, the title of the job, it's an overview about the duties and responsibilities. This describes the do's and don'ts of an employee, authority of incumbent, which describes the reporting relationship and decision-making power, standard of performance, which includes quality of work and timelines and policies and procedures. Working conditions describes the physical requirement, work hours, and workload and flexibility. Job certifications, this includes the education requirements, skills, certifications, and competencies, language requirements. Importance of job description in human resources management. Recruitment and selection. Job description is important in understanding the role and its requirements. This helps attract suitable applicants and streamline the selection process. Performance management. Job description serves as a benchmark for evaluating the employee performance. By outlining the duties and responsibilities, job description provide a reference point for assessing whether employees meet the required standards. Training and development. Job descriptions highlight the areas where employees may need additional training to perform their duties effectively. Legal compliance. Job description helps to ensure compliance with employment laws and regulations by clearly defining job requirements and expectations. Organizational structure and clarity. Job descriptions provide clarity about reporting relationship and organizational hierarchies. Compensation and benefits. Job description serves as a basis for determining appropriate compensation and benefits for each role. By outlining the responsibilities and qualifications required, job descriptions help to establish fair and competitive pay structures.
Thank you, Inba, for explaining the job description, what is called like job description and its importance. My name is Jigar Prajapati, and now I'm gonna talk about why it is an issue in human resource management. So, first one is it's aligned with the organizational goals. Like every role in the company is designed to help reach out the common objectives of the company. When everyone knows their part, they can work all together to effectively to achieve their goals. The second one is employee performance. It contains clear expectations leads to better performance and job satisfaction. It's like imagine trying to build a piece of the furniture without clear instructions. It would be the frustrating and take a longer time to complete it. However, if you have a step-by-step instruction, you can make it. In the same way, when employees have a clear job description and understand what is expected to them, they can perform their task more effectively, and this is clearly leads to the better performance in the company. The third one is legal protection. These rules help to prevent the disputes and the misunderstanding among the employees. Like it's a clear job roles and responsibility act like these rules. This helps to prevent the legal issues by providing a clear understanding of what each employee is responsible for it. So this is the issue why it is an issue in HRM. Next one is a job description for a nursing leadership job. In that, we're gonna use the functional approach because it's focused on the skills, knowledge. It's focus on the skills, knowledge, and the specific task of the employee. Like when writing a job description for a nursing leadership role, the organization uses the functional role. It can help to find out the specific skills and knowledge from the employees, like they are looking for the right candidate. And these skills are crucial because the nurses leader often face complex situation, and these skills include the communication skills, problem solving skills, and the decision making skills. So by concentrating on them, and outcome is expected in the role, the organization can identify the candidate who are the flexible and adaptable and capable of handling the capable of handling various healthcare challenges. So now Roshni will continue.
Sorry. Hi, it's Yashvi Chaudhary, and I'm gonna thank you, Jigar, for why job show for making us understand why job description is a part of HRM. Now, if we are writing a job description of a clinical nurse leader role, so the roles and responsibilities will be there in the job description. So here are the roles and responsibilities of the nurse leader, which is to develop, implement, and monitor patient's care plan, to lead, mentor, and coach a team of nurses, to conduct performance evaluations and give constructive feedback, to manage this staff scheduling and ensure adequate staffing levels, to identify and address staff concerns and maintain a positive work environment, to ensure compliance with hospital policies, regulations, and procedures, to implement evidence-based practice and to improve the patient's outcomes. And a nurse leader should have, the role will be having to communicate with other healthcare professionals like physicians, therapists, and others, to participate in continuous quality improvement initiatives, and to conduct staff training development programs. Now the next is qualifications. Job descriptions have a section of qualifications which can show for a nurse leader. A nurse leader should be registered nurse with a regulatory body, just like a College of Nurses of Ontario. A nurse leader should have at least 1 year of experience in leadership role within a healthcare setting and minimum of 3 years of clinical experience in nursing, clinical nursing experience. And for their education, they should have a Bachelor of Science in Nursing for sure. And if they have Masters of Science in Nursing, that's the additional degree, but not compulsory. Now the next slide is skills. Job description describes the skills needed for the role of a nurse leader. which are strong leadership and communication skills, excellent interpersonal and problem solving skills, ability to delegate the task effectively and prioritize the task, commitment to patient centered care and quality improvement, and proficient in EHR and relevant healthcare softwares. Now, here are the core competencies a nurse leader should have. It can be also there in a job description. So, effective leadership, ability to lead others and develop a positive work environment. The next is self improvement. A leader should be committed to personal development and can help others to improve the people around them. Then, achieving organizational goal. A leader should focus on meeting the goal of the organization they are working for. Now, the collaboration. A leader should have great relationship with their practice, academic, and industries. Now, Roshni will continue.
Thank you, Yashvi. Hello, myself Roshni Chaudhary. Now I'm just going to give you an example of a job description. So here is one example of job description, and in this it include like job title, salary grade, job family, division, and also the department that we are all going to apply in the like particular department, job code, even in the location and date. In the summary, it's like going to describe about the like a brief summary of the job, and like it's also includes scope and impact of the job, what is the responsibility and what is the supervisor responsibility. It also showing and including about required knowledge and what the experience, skill and abilities we can include in the job description. And last, it also showing some primary responsibility that we can include in the job description. So this is the whole example of the how to write the job description, and it's showing all the different content for the job description. Now in the next slide. So here some are questions that we can ask during job description to for like finding right candidates for the job. So if like we are hiring any nurse leaders for the hospital or either any healthcare setting, so we can ask, can you describe a time when you had a manage a conflict within your nursing team, and how did you handle it? So reason behind asking this question is to check the candidate can handle dispute any issue and maintain good relationship among team members, and also managing conflict well is a key to peaceful and effective workplace. Another question is, how do you prioritize tasks and delegate responsibility in a busy healthcare setting? So this question look at the candidate's ability to stay organized and assign tasks to the others, because in this rush setting it's hard to like manage everything. So these skills are important for making sure everything runs smoothly and patient get the best care. Last is, how do you support and develop your nursing staff to enhance their skill and career growth? So this question assess whether the candidate can help the like staff team members and another staff to like advance and gain more knowledge and everything in their career, like during practicing their in healthcare setting, and also supporting and mentoring staff to create a positive and encouraging work environment. So, in the summary, job description outline the roles, responsibility, and qualifications supporting recruitment, also performance evaluation and training while aligned with the organization goals. For clinical nurse leader, use of functional approach is essential for focusing on patient care, leadership, and complements. essential qualification, as we discussed, we need to align with the RN license with a regulatory body and leadership experience. Another is key interview question that we already mentioned before, that should help to assess the conflict management, task prioritization, and staff development. In next slide, these all are our references that we used in our presentation and in our works.
Thank you all.
Thank you for joining and listening us. Thank you.
Thank you.